What do you think is the biggest mistake people make every day for dental health?
The biggest mistake that people are making while brushing their teeth is they are not cleaning in between their teeth. So there's a lot of plaque deposition and food debris lodgement that happens in between the teeth. So we actually advise our patients to do more of flossing than brushing.
How long do you think a person should spend in brushing teeth?
So, see, ideal time is actually 2 minutes. So, nowadays there are 2 timers.
Okay.
Yeah, and also if anybody is using a electric toothbrush, they have 2 minutes of timer. Like after 2 minutes, the toothbrush beeps. Everybody, all the age groups must brush for 2 minutes.
So, Dr. Jeensy, welcome to our show. Dr. Jeensy operates from Golf Course Road,
Sector 42.
Sector 42, Whitecoats Clinic.
Whitecoats.
She's very famous though, huh? Though आज उन्होंने बहुत request किया तो she's here with us today. So, welcome to our show, Dr. Jeensy, in FCR Bytes. First of all, I wanted to know, what do you think is the biggest mistake people make every day for dental health?
The biggest mistake that people are making while brushing their teeth is they are not cleaning in between their teeth. So there's a lot of plaque deposition and food debris lodgement that happens in between the teeth. So we actually advise our patients to do more of flossing than brushing. There are many people, so toothbrush cleans about only 60% of the tooth surfaces.
Is it?
Yeah.
Okay. So flossing is very important then.
Flossing mainly cleans the in-between teeth spaces, which actually creates cavities and food debris trapped.
Okay, so
inside
basically,
them.
we don't know about it and we just do it, the brushing in a very casual way.
Casual.
But then as you said, flossing is very important.
Yeah.
How long do you think a person should spend in brushing teeth?
So, see, ideal time is actually 2 minutes. So, nowadays there are 2 timers.
Okay.
Yeah, and also if anybody is using a electric toothbrush, they have 2 minutes of timer. Like after 2 minutes, the toothbrush beeps.
Okay, so you know when to stop.
When to stop.
Oh, that's
Absolutely.
great. That's great. And does it applies for everyone? Like, elderly and the younger people?
Yes,
all of
yes.
them?
Everybody, all the age groups must brush for 2 minutes every time.
And twice a day?
Twice a day. Yeah. Recommended is
Morning
twice a day.
and before going to bed, yeah?
Morning and before going to bed. In fact, we ask our patients to do more of night brushing. That's very important than day brushing.
Why do you think so?
So the thing is ki in the daytime, we are having so much of oral activities, like we are eating food, we are drinking water, and there's salivation all the time into our mouth. Our tongue is a self-cleansing agent which moves all over your teeth.
Okay.
If there's any food stuck, the tongue helps in a self-cleansing way. And at night, all these activities are stopped. So if the food is stuck in between your teeth, so that's stuck for a quite long 7 to 8 hours. You
Right,
don't
that's
even drink
quite-
that much of water.
Yeah.
There's no salivation. So
it's better.
night brushing is
More
very
important.
more important.
So my next question would be like, how often should someone visit a dentist?
Okay. So in this, the classic answer is obviously 6 months.
Okay.
Every 6 months. And the real answer would be actually it depends. It depends for high risk patients and low risk patients. For high risk patients, as in if the patients are having diabetes, smoking habits, poor oral hygiene, gum diseases, so these patients must visit a dentist every 3 to 4 months. And for low risk patients, like they don't have a history of cavities, they have a good oral hygiene maintenance and oral hygiene habits, they are flossing more regularly. For these patients can visit like 9 to 12, matlab once in 9 to 12 months, yeah.
So like once in a year or so.
Yeah,
Is
yeah,
it? That would be fine
also.
with a-
So in dentistry, we always say that prevention is always better. See, don't wait for a toothache to see a dentist. Prevention is always easier, cheaper, and time saving.
Okay, next question is, can poor oral health affect overall body health?
Absolutely, yes. See, your mouth is not separate from your whole body, and poor oral hygiene can lead to many diseases like heart diseases, pregnancy complications, oral cancers for that sake.
Oh, is it?
Yes, absolutely. Diabetes, hypertension, gum diseases. So there are various factors that and we have theories and studies related to poor oral hygiene, relating to oral cancers.
Really?
Yes, absolutely.
You should definitely look after your oral health properly, I think, in order to avoid complication of your overall well-being. Isn't it,
Absolutely.
doctor?
Yes,
Yeah.
yes, correct. So we say that we also believe that, there are body sends you signals, signs and signals before any damage which is being there into your body. First signs are always seen in your oral cavity.
So what are the early signs of gum disease people are ignoring basically?
People mostly often ignore the initial gum disease stages because they are mostly painless, first of all. And gum diseases that shouldn't be ignored are some like bleeding gums while you are brushing and flossing. There are red, swollen and tender gums. Persistent gingivitis, recession of gums, which in a later stage may lead to tooth loss. So these are some of the signs that people shouldn't be ignoring.
Are teeth whitening completely safe?
Okay. See, teeth whitening is one of the safest treatment in dentistry when it's done right and under professional guidance. But again, it's not one size fits all treatment. It a first dental examination ensures that whether your teeth and gums are healthy enough to take up the treatment.
I know people are sometimes, they have this fear getting it done, the teeth whitening.
So it's not the products that are being used in teeth whitening. It's mainly your teeth and gums, how healthy they are enough to take up the treatment.
So do dentists do some initial checkup to find out this?
Absolutely, yes. There should be a thorough examination that has to be done first before going for any of the dental treatments for that.
So why do some people get, cavities despite of brushing regularly?
Regularly is important, but there are various factors that can still cause cavities. So first is your brushing technique. So most people brush thoroughly, like front and back of your tooth surfaces, but they almost forget to clean the interdental spaces where mostly the plaque accumulates. And the second point would be like dry mouth. See, saliva plays a very important role neutralizing the acids into our mouth. And dry mouth is one of the main cause for causing cavities into our mouth because food debris doesn't get washed away so easily. Not flossing daily is one of the cause that cavities can still develop.
I know you already told us about the importance of flossing, but again I would like to ask you, how are you going to compare it to brushing?
Okay, so again, flossing is very important because there are many food debris and the plaque accumulation that happens under your gum line and in between your teeth. So that's how we recommend our patients, especially implant patients and the patients who has crowns in their mouth, that you should regularly use a water flosser. So many patients ignore flossing because they are not comfortable with the traditional thread method of flossing. So nowadays that modern dentistry has advanced so much, water flosser is a very convenient way that you can use on a daily basis. In fact, I recommend my patients like how do you carry your toothbrush and toothpaste for whenever you travel outside or whenever, So you should carry your water flosser also that
Water flosser. Okay, I'm going to get it today.
Yeah. Most recommended.
Good. Okay, so now, like most of the people, they are fearful on visiting dentist, right? So what do you recommend how they can overcome this fear?
So most people fear dental treatments because of their previous painful, unpleasant experiences during a dental treatment. Now, modern dentistry has advanced considerably so much that minimal procedures can be done with very minimal discomfort. I mean, the routine procedures are done with minimal discomfort when proper anesthesia and patient-centered care are being given. When a patient is given a pain-free and respectful treatment, so patients experience that their dental anxiety have dramatically decreased over time.
So I think as you mentioned, with proper consultation, and with the modern equipments and all, the pain has, I think, gone down, and then, isn't it? So
Yeah.
people should not be fearful on visiting a
Fearful.
dental
Yes,
treatment anymore.
Correct.
Yeah. Okay. So what? Finally, I would like to know. What causes bad breath even after brushing?
So bad breath, unlike halitosis, persist in most of the patients even though they are brushing twice a day and flossing regularly. There are several reasons for it. Considering first would be tongue coating. That means they are not using a tongue cleaner on a regular basis. Then there could be underlying gum disease, gingivitis or periodontitis, which would be one of the causes for halitosis. Some systemic disorders like diabetes. Why diabetes? Because diabetic patients have a dry mouth usually. Okay, and dry mouth is considered could be because they are taking some long time medications.
Because of that.
Could be because of
One
that
of the-
as well. Yeah. Sometimes patients are having sinus or throat infections. In that also halitosis can.
Let me know if it's true or if it's a myth. Like in our society, they say if you haven't eaten for a long time, then you get bad breath. Is it that the case?
Yeah. So this I would like to clarify. It also happens because of dehydration.
Dehydration. Okay.
Yeah, that's one of the main causes for halitosis in normal people.
So, Dr. Jeensy, thank you for the insightful podcast and the information that you have shared with us.
Thank you so
Thank you for
much. It
coming.
was a pleasant week here.
Thank you.
Thank you.